Gentleman from Indiana Reserve. Gentleman from New Jersey is recognized.
Mr. Speaker, I yield now 3 minutes to the gentlewoman from Texas, Ms. Sheila Jackson Lee.
Gentlelady is recognized.
This is another moment that I'm on the floor of the House, and I thank the ranking member of the Committee on Energy and Commerce, who has been so dutiful throughout the years that we suffered somewhat lonely and somewhat confused about COVID-19. We'd never experienced this trauma, and it certainly brings me to a deep sense of loss to hear a member speak about the loss of his mother. These are personal matters for many of us. Some having lost dear friends, but nothing can equate to losing a beloved loved one. And so when we stand on the floor, we speak with a sense of compassion and concern. I think it is certainly fine for there to be individual, I turn the card, I flip the coin, individual examples of individuals seeking not to be vaccinated. They can find medical facilities that would allow them to work there. But it is no doubt that the actions of the Biden administration save lives. There is no doubt that on our side of this issue, 50 healthcare organizations, professional societies, and others believe that vaccinations help healthcare workers save their own lives and save the lives of others. It is well known that prior to the widespread availability of COVID-19, healthcare workers in the United States were more than 3 times more likely to die. I've seen them myself. In my community is the Texas Medical Center. All of the beds in every medical facility within the reach of my district and others had people in hallways, in emergency rooms, individuals who couldn't see their loved ones take their last breath, individuals who flew in from other jurisdictions, other states, desperate to get the care they thought was here in Houston, Texas, because yes, we did have the ability to save lives with the technology, medical technology that we were using. Many states have requirements that healthcare workers be vaccinated against many things: hepatitis, flu, measles, mumps, or rubella. Why are we trying to stand against COVID-19, which is a long litany of infectious diseases? COVID-19 vaccines have resulted in 120 million fewer cases and 18.5 million less hospitalizations, and saved $1.15 trillion. So if we just talked about the numbers, that in and of itself would say that this legislation is wrong-headed. But it is also important to recognize that the Mental Health America, 76% of the respondents were worried about bringing COVID home to their children. These are healthcare professionals. We know of some of them who died, unfortunately, because they got COVID and they didn't even see their families because of this whole issue of separating people who had COVID. Half of the respondents worried about bringing COVID to their partners or an older family member. Many U.S. physicians found that the portion of the day spent treating COVID-19 patients was associated with higher PTSD scores, depression, and anxiety. This was not a fun time, but it was the commitment of medical professionals and those who wanted to get to be saved to use the vaccines and use all precautions. Can I get 30 seconds?
Ladies recognized.
I thank the Speaker for his indulgence. These medical professionals in the early stages were suffering from higher PTSD scores, depression, and anxiety. Many healthcare workers at the beginning of the pandemic saw workers get sick and die from COVID almost right in front of them, and this contributed to their increased stress and anxiety. We did push them to the limit when we didn't have massive testing or massive vaccines. I hate to say it, in the past administration. According to the University of Chicago, it was found that an increase in staff vaccination rates resulted in fewer COVID cases among staff and patients. My final words, Mr. Speaker, is, yeah, this is a free country, laissez-faire, do as you will. But this mandate for medical workers saved their lives, saved patients' lives, and saved families' lives. And I don't understand why we're going down this route, where soon it will happen in good time. But since I remember 6 million dead around the world as a number that is gleaming, and 1.11 million in the United States, this legislation is not going in the right direction. I ask for opposition to the underlying legislation. I yield back. Thank you.
Gentleman